Healthcare has been one of the most debated topics in U.S. politics for years, and as we gear up for the 2024 election, one key candidate to watch is Donald Trump. Trump, who served as the 45th president, is back on the campaign trail with promises to reform healthcare. But what exactly does his plan look like for 2024? Today, we're breaking down Donald Trump's healthcare proposals, what he wants to do with Obamacare, how he views Medicaid, and what his administration might mean for prescription drug pricing. Trump's view on the Affordable Care Act, Obamacare. Let's start with one of the most well-known pieces of legislation in U.S. healthcare, the Affordable Care Act, ACA, commonly referred to as Obamacare. Trump has been a longtime critic of the ACA, calling it disastrous and ineffective during his previous term. But what is his stance on the ACA heading into 2024? During his first presidency, Trump made numerous attempts to repeal and replace the ACA. However, these efforts were blocked in Congress, with his administration failing to eliminate it despite dozens of attempts. So, what's his plan now? While Trump's 2024 campaign hasn't provided a full policy document, Trump has indicated that he no longer plans to fully repeal the ACA. Instead, Trump has suggested that his focus will be on making it better and less expensive. This marks a shift from his previous stance, where he vowed to dismantle the ACA entirely. His 2024 plan may include targeted modifications, particularly around insurance minimum benefits and pre-existing condition protections. Trump has stated that he wants to give insurers more flexibility, which could allow for cheaper plans but might also reduce the level of coverage. Promoting market-driven healthcare solutions. One of the key aspects of Trump's healthcare philosophy is his emphasis on market-driven solutions. Trump believes that competition and deregulation are the keys to lowering healthcare costs and improving quality. He favors giving states and private insurers more flexibility in designing health insurance plans. This would reduce federal regulations that currently require insurers to cover certain essential benefits, like maternity care or mental health services. Trump argues that by loosening these restrictions, insurers can offer cheaper plans tailored to specific needs. Critics of this approach, however, point out that this could lead to bare-bones plans that provide less coverage, which may leave individuals vulnerable to high out-of-pocket costs for essential medical services. Proponents argue that consumers would benefit from having more choices and lower premiums. The future of Medicaid under Trump. Medicaid, the government health program for low-income individuals and families, is another area where Trump's policies could bring significant changes. During his first term, Trump pushed for a block grant approach to Medicaid, where states would receive a fixed amount of funding and have more control over how they use it. Trump's 2024 platform likely includes a continuation of this block grant model, which gives states the flexibility to design their own Medicaid programs and manage costs. The downside is that it could lead to reduced coverage or benefits if states decide to limit access due to budget constraints. Trump's stance on Medicaid also includes rolling back some of the expansions introduced by the ACA. During his presidency, he supported allowing states to add work requirements for Medicaid recipients, which would require individuals to be employed or actively looking for work to receive benefits. Critics argue that this would disproportionately affect low-income families, while supporters say it encourages self-sufficiency. Prescription drug pricing. One of the major issues Trump has addressed both during his presidency and in his 2024 campaign is the high cost of prescription drugs. Drug prices in the U.S. are some of the highest in the world, and Trump has promised to lower these costs. During his first term, Trump pushed for allowing the importation of cheaper drugs from countries like Canada. He also proposed reforms aimed at increasing transparency in drug pricing, so that consumers know what they're paying before they go to the pharmacy. Heading into 2024, Trump has suggested that he would continue these efforts, but the specifics of his plan are still unclear. What is clear is that drug pricing will be a key talking point for his campaign, and we can expect him to criticize the Biden administration for not doing enough to bring costs down. A shift in tone, conceptual healthcare plans. One interesting aspect of Trump's 2024 healthcare platform is that there has been no full detailed plan released yet. Instead, Trump has spoken about concepts for healthcare reform without providing a comprehensive policy outline. He has said that his team is exploring different ideas and that more details will be revealed as the campaign progresses. Trump's approach seems to focus on flexibility and adaptability, allowing for market-driven solutions and state-level control, but without the same level of specificity that we've seen from other candidates. Critics argue that this lack of detail raises questions about what exactly his healthcare system would look like, while his supporters claim that this flexibility allows for more tailored solutions to different healthcare challenges. What does this mean for you? So, what would Trump's healthcare approach mean for everyday Americans? If Trump is elected, we can expect 1. More flexibility in insurance plans, which could result in lower premiums but also potentially reduced coverage for essential benefits. 2. Changes to Medicaid, including more state control and the possibility of work requirements. 3. Efforts to reduce prescription drug prices, though the specifics are yet to be detailed. 4. A focus on deregulation and free market principles, which could drive competition but may also lead to disparities in coverage quality depending on the state. Trump's healthcare approach reflects his overall belief in reducing federal government involvement and giving more power to states and private companies to shape healthcare solutions. Challenges Trump could face. While Trump's healthcare proposals might appeal to his supporters, there are significant challenges he could face in implementing them. First, funding Medicaid block grants and providing affordable health insurance options without the ACA's regulations could be difficult to balance. Additionally, opposition from Congress, especially if Democrats control one or both chambers, could block many of his deregulatory efforts. Trump's last term saw major healthcare reforms stall in the Senate, and it's possible that similar roadblocks could arise if he's re-elected. Lastly, the complexity of the U.S. healthcare system itself means that sweeping changes are hard to enact without facing legal challenges, as we saw with attempts to repeal the ACA in 2017. Trump's healthcare plan for 2024. Let's recap Trump's key healthcare positions. 1. Opposition to the Affordable Care Act, though he's no longer pushing for full repeal. 2. Market-driven solutions with more flexibility for states and private insurers. 3. Medicaid reforms, including potential work requirements and block grants. 4. Prescription drug pricing efforts, though details remain to be clarified. 5. Conceptual healthcare ideas that may evolve as the campaign progresses. Trump's healthcare platform is built on deregulation, competition, and giving states more control. But what do you think? Is this the right direction for healthcare in America?